matter is that snakes are really king of the world, because if you look at the stethoscope, all your medical things, there's two snakes, right? Yeah? Why we put the snake there? Is indeed the king. The snake is the only guy that has two penises.
No, the lizard also has.
So when one is in action, and when the snakes do their thing, they do their thing for days. You watch the Discovery Channel? Yeah, when the snakes do their thing, they do it for days. Because when one is rested, the other one is working. When the other one is sad, the other one is going into action. That's true. The snake has two penises, they call them hemiphaluses. So this is what Eve learned. So some may have, that's all the problems of the world. So that's why we have an entity that has they call it. Some men think when they are the three balls, they're supermen. Only when they go realize the thing is getting bigger. So this is not normal. She goes, this cancer or something that is bigger. Don't lose the natural reaction. Just like, man, I'm checking it out more. Okay. At the lower pole of the testicle, and attached to the lowest part of the scrotum, is often some fibrous component, the so-called scrotal ligament, which is the remnant of the gubernaculum testicle. Whether the gubernaculum plays a part in the actual set of the testicle. In our days, we were taught so, but in our days, view is that it is. So, right? I'll leave that there. Now, you need to know the nerve supply of the scrotum, because I always ask in many ways. The anterior two-thirds of the scrotum, yes, the skin, the anterior two-thirds of the scrotum, the skin, is innervated by two nerves, and you all know them. Remember we mentioned the inguinal nerve passing through the inguinal canal? That's one, L1. And the genital branch of the genitofemoral nerve, still L1. So the anterior two-thirds of the scrotum is supplied by two nerves. Yeah? And it's L1. Got that? The remaining scrotum, that's the posterior third, is also supplied by two nerves. In this instance, they have the posterior scrotal nerves, which are usually two, but it's one. Posterior scrotal nerve, and that's coming from the perineal branch of the pudendal nerve. Okay? So that's one of two on the back here. The posterior scrotal nerve. And you're all familiar with this fella here. From your gluteal region, you remember the sciatic nerve. And running just medially or on the surface is this fella. You all remember who he is? No. Yes, it's the posterior femoral cutaneous nerve of spine that goes all the way down to the calf level. Remember? Well, it gives off scrotal branches, posterior scrotal branches. So the posterior scrotal branches from the pudendal and from the posterior femoral cutaneous nerve, and that's S2 and 3 nerves. Eh? Do you understand that? So the axial line of the lower limb, and you all know by now what we mean by axial line, right? Will obviously pass through the scrotum between its anterior two-thirds, L1, and the posterior third, which is S2 and 3. Appreciate that? And we make use of this knowledge because when people become paraplegic, when they have this cord transection, spinal cord transection, the bladder is now trained to become automatic because the sensory pathway from the bladder to the sacral root of the spinal cord is still intact, and the efferent path back to the bladder is still intact. Yeah? So what we do is train the patient, these paraplegics, to pinch or tickle the S2-3 area, that's the posterior scrotal area. And impulses, and with training, will cause a fire in our whose nucleus again? On our nucleus to relax. And the S2-3 component of the parasympathetic system tells that you get a contract. And that's how the guidance is bladder. These are paraplegic people. And that's an automatic bladder. Okay? Good. This diagram is just showing the ilia inguinal and the genital femoral. The genital branch of the genital femoral nerve coming down anteriorly. Now, the blood supply of the scrotum. Posteriorly, we have the posterior scrotal artery, a branch as well from the pudendal artery. Yes? It's coming the perennial branch of the pudendal artery, and it will give off the posterior scrotal artery, just like the nerve would have. Alright? And you'll have the corresponding vein draining in that aspect. Anteriorly, you all listen to them, or might have seen some of the anterior arterial supply to the scrotum. You remember them? There was a superficial external pudendal artery when you did the side, the superficial external pudendal artery, and the deep external pudendal artery. And they are superficial and deep to what? Spermatic cord. Okay? And similarly, you have the superficial external pudendal vein and the deep external pudendal vein, and they are superficial and deep to the spermatic cord. In this instance, you only see the superficial branch. Yes? But they are draining into the termination, usually, of the lungs of the vein. Appreciate that? That's just revision for you. So the nerves, arterial supply of the scrotum, the venous thing. And lastly, is the lymphatics. Posterior lymphatics will go with the posterior scrotal, the pudendal to the internal iliac chain of nodes and go to the common iliac and all the way up. Whereas the anterior will drain to the medial group of superficial inguinal nodes. Okay? They follow the arterial and venous supply there. Alright, that's just the diagrams which are explanatory. Okay, so we said the spermatic cord. Now moving from the scrotum to the spermatic cord. Spermatic cord is formed by the constituents to and from the testicle. So you'll have the vas deferens, yes. You'll have the testicular artery and the pampiniform plexus of veins. What we won't show you is that there are lymphatics running with them. Yes? And all of these structures are covered over by these 3 layers which I mentioned earlier. And there are supposed to be 2 nerves inside the whole cord structure. Autonomic sympathetic nerve fibers which are running with the artery, and with the cremaster, they get twigs from the genital branches, genital femoral nerves. So those are the 2 nerves. There are 3 arteries in here. One you can usually see, the testicular artery. The other is the artery of the vas. And thirdly, arterial branches with the cremaster. You won't see these at the time of surgery. The last 2, that is the cremaster arteries and the vas arteries. So the time you see that, they should cut them and start but you'll certainly see the testicular artery. And they come down. I'll speak with you about the testicle and vas, etc. at another lecture. But they form an important anastomosis together, so that at the time when we're doing hernia surgery, some are very difficult, these hernias. Some are almost big and small, And when we're checking out these things, sometimes we accidentally divide the testicular artery. But because of the street we supply to the testicles, it will survive. Although some people say the actual function of producing sperm will be impaired. It's not dead, but the actual supply for production. Remember, the testicle is ready to working overtime. It will not die. Okay, so I need to get a review to you now.